Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, November 18th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, the focus of today's message is on retiree health insurance and healthcare policy here in Massachusetts, and some of our recent meetings and activities around, ensuring that you have access to affordable, high-quality healthcare throughout your entire retirement. But before I get into those details, let me first update you on a couple of other items. Today at 11 a.m. in Westport, our association will be holding our first meeting in 3 years down on the South Coast at White's of Westport. It is our traditional meeting location for the Fall River, New Bedford, Taunton area. We are very excited to be getting back out there again and being able to hold our area meetings. We're anticipating a great crowd today. Again, it kicks off at 11 a.m. All of our in-person meetings run about 90 minutes or so. We try to get people in and out of there relatively quickly. White's is a great location. They do a fantastic job of hosting our meetings and taking care of our members. So I'm very much looking forward to seeing those of you who are able to attend. We do have one more area meeting coming up in December in Auburn on Friday, December 16th, the week before Christmas. That will be our final meeting of 2022. You will find a full schedule of upcoming meetings for 2023, both virtual meetings through our teletown halls as well as in-person area meetings. We're now in the process of scheduling all of that. We're really excited to be able to get back out there and interact with our members on a face-to-face basis. Also, I have some great news to share. On late Wednesday afternoon, Governor Charlie Baker signed into law the local retiree, local option COLA legislation that we have been talking about. This has been in the works now for months. The legislature passed it a little bit over a week ago, sent it back to the governor. He has signed it with an emergency preamble, and what that means is that the law takes effect immediately. So the 102 local retirement systems are now in a position to increase the COLA that went into effect for FY23 this past July 1st. All 102 systems approved a full 3% COLA for FY23. This new law allows those 102 systems to increase the local COLA by an additional 2%. So instead of paying a 3% COLA, the option is now there to pay a COLA up to 5%. Now, state and teacher retirees received a 5% COLA retroactive to July 1st. That was already paid this past summer. So this new law allows the city and town retirement systems and the regional systems and the counties and so forth to also pay a 5% COLA. In addition to requiring the approval of the local retirement board, the law also requires that the local government also approve the COLA increase. So we are going to be working very closely with the local retirement boards and retirement board members. Remember, each board has 2 elected members serving and representing local retirees and your interests on the board. And we will be working very closely with those elected members who are really going to have to take the bull by the horns in some cases and make sure that the COLA continues to receive the attention that it's due in ensuring that the success that has been witnessed, not just at the state level, but at the local level over the past decade or more in terms of really robust investment returns. And despite the fact that 2022 has been a difficult year for the financial markets, if you look back over the 36-year or more history of our public retirement systems here in Massachusetts, with very, very few exceptions, each and every local retirement system, as well as the state and teachers systems, have done extremely well over that period of time. And we strongly believe that that success should now be being shared with retirees in the form of improved COLA benefits. So that's where we stand with the COLA. Now, as I said at the outset of this message, the main focus this week is on retiree health insurance and healthcare policy. Those of you who have been members of Mass Retirees for a while, I hope you have come to understand and realize that a big part of the work we do here at Mass Retirees, in addition to the COLA and lobbying and advocating on your behalf, in addition to all of that, is focused on retiree health insurance and retiree healthcare policy in general. The key thing is to continue to ensure that all of our members, regardless of where you receive your health insurance benefits from, whether it be from the state GIC or one of the local insurance purchasing groups, or from a standalone plan like we have here in the city of Boston, across all 102 retirement systems in the 351 cities and towns that exist across Massachusetts. The key thing is to ensure that retirees in particular have access to the highest quality and affordable health care possible. And that is not always an easy task, particularly over the past decade or more, where we've seen healthcare costs continuing to rise, with a certain point of view from some individuals and some organizations out there, the Pioneer Institutes of the world, and the Mass Taxpayers Foundation at times, and the Mass Fiscal Alliance, certainly advocating for cutbacks on public employee and public retiree benefits, advocating for the growth of co-payments and deductibles, so cost shifting, and we know that that is not the direction, the proper direction that we see these things go in. So it's very important for us to have a seat at the table, to give a voice to this process, for the starters to educate our members, to have some input into where all of this is going, and to help promote and encourage the steps that are being taken, particularly here in Massachusetts, to gain control over these costs and try to keep a lid on further cost inflation of these prices going up year in year after year, with no end in sight. And I think that in recent years, between the GIC and what's been happening at the local level here in Massachusetts, everyone collectively has done a really good job of containing these costs while at the same time maintaining very high quality healthcare benefits and health insurance benefits for not just retirees, but public employees across the board. Unfortunately, we are now seeing those costs starting to go up again. Prescription drugs, hospital stays, all those sorts of things are really continuing or starting to take off again in terms of inflation. Now, one of the things that we're very proud of is the role we play with Blue Cross and Blue Shield, for instance. Our association has maintained seats on Blue Cross Blue Shield's Insurance Advisory Committee, which is made up of all of the labor unions in Massachusetts as well as Mass Retirees, to make sure that our members have a seat at the table, a voice in the process, and it enables Blue Cross, to their credit, to have the ability to use our organizations collectively as a sounding board for new ideas and innovations that Blue Cross is promoting and working to develop, with the goal of not just keeping a lid on health insurance costs, but the goal and the hope is that over time, these innovations are leading to healthier enrollees and improving the quality of life of everybody, while at the same time controlling costs. It's a true win-win if they're successful. Now, this past Tuesday, I participated in a Blue Cross Labor Advisory meeting. They explained some of the innovations and presented some of the innovations that are now taking place in the area of primary care and the access to primary care doctors and the evolution of those services, and at the same time, the evolution of behavioral health and recovery services. So it's really interesting work that's taking place. Again, the goal is to keep enrollees, and in this case retirees, healthier. The healthier you are, the less likely you are to need to utilize your insurance and have to be on various medications, or the need to be hospitalized is certainly reduced, while at the same time improving everybody's quality of life. Now, just yesterday, The Group Insurance Commission received a report from what's known as the Health Policy Commission, the HPC. The HPC was created about 10 years ago. It was the first of its kind in the nation. And over the past few years, 7 other states have taken what Massachusetts has done with the HPC and replicated that at the local level in their states. And the focus of the HPC is really a couple of different things. One, they collect healthcare data from insurance companies, from the hospitals, from the doctors, from Medicare. The federal government shares Medicare data with the HPC. They collect all this data, they analyze it, and they look at healthcare cost trends, what different policies may or may not be happening in terms of their impact on healthcare quality and healthcare cost. And they take all this information and they try to predict going forward of where things are heading here in Massachusetts as well as nationally, and what that impact could be on Massachusetts healthcare delivery. And don't forget, a very large portion of our state's economy is now dependent upon and related to healthcare, whether it's the hospitals, the pharmaceutical companies, the biotech companies. All of that industry has a huge footprint here in Massachusetts. So it's not just the impact on patients and enrollees, it's also the impact on the overall state economy and our citizens of our state. So it's very complicated work, it's very interesting work, and while it was sobering to hear about the recent increase in costs that we're all going to be faced with in trying to get a handle on, it was encouraging at the same time that those increases, by and large, are less than what we're seeing at the national level, as well as in the case of the GIC and Blue Cross, for example, the cost increases that the GIC and the Blues have seen in recent years, by and large, are less than what we see in the private sector here in Massachusetts. So at the end of the day, there's a success story here that we are heading in the right direction, that things are being done correctly to try to keep some control over these costs while maintaining that very high standard of care, but certainly more needs to be done. So that's why the work being done by Blue Cross Blue Shield and by Unicare, and you may recall a few months ago we ran a story about the whole person health focus that Unicare has recently begun to take and will continue to take heading into FY24 and beyond. Again, the same type of approach that Blue Cross is taking, Unicare and other insurance companies are also involved in, with the goal of improving the overall healthiness of their members. And at the same time, we have been reporting on innovative approaches, such as the one taken by Sensio Systems, which we have reported on quite frequently. Sensio is the parent company of the IBIS platform. IBIS is a technology, it's a tablet that is designed to integrate with retiree care. It's designed or focused on the Medicare population, with the hope of helping retirees who are suffering from chronic illnesses and other medical problems, to help them manage their care with the goal of helping them to lead a healthier life going forward. So we're very excited by some of the things that we're seeing taking place here in Massachusetts at both the state level, the local level, and in the private sector. All of these folks are working together, and as I say in today's email, we are very fortunate here in Massachusetts to not only have access to some of the best doctors and hospitals available anywhere in the whole world, but the fact that we also have government officials, insurance officials, private sector business leaders coming together and really putting their heads together to come up with new and innovative ways of delivering healthcare, keeping people healthier without the need to cost shift. And one of the things that they pointed out in the HPC presentation to the GIC is the danger that exists if you simply cost shift, if you simply increase copayments and deductibles and making the enrollee pay more what that does, particularly with lower income or fixed income individuals and retirees, it forces them to avoid using their health insurance because they simply can't afford to. And if you're avoiding using your insurance or avoiding going to the doctor, even though you should, that's only going to lead to greater problems down the road and greater costs down the road. So everyone loses under that scenario. So that's a point that the HPC officials pointed out several times through their presentation to the GIC. So there's a lot going on. We are very focused on healthcare policy and particularly retiree benefits when it comes to healthcare. And look to the January edition of The Voice. We have further information and further detailed information on these topics that we'll be publishing. But this is going to remain a really hot topic for us. So it's something that if you are interested in healthcare policy, and hopefully all of you are because of the impact, please keep a close eye on these weekly videos and The Voice, because we'll be sharing as much of this information with you as we possibly can. Now, before I close out today, I want to wish everybody a happy Thanksgiving. This will be our last update until December. We're going to skip a week next week for the holiday, but we'll be back to you with a video and the weekly email message on Friday, December 2nd. Our toll-free hotline will also pause next week. We're not anticipating really any real breaking news to report. If anything happens, we'll get the word out to everybody, but I think it's going to be a pretty quiet week in terms of policy next week. So enjoy Thanksgiving. Whatever your plans may be, whether it's getting together with friends or family, or simply enjoying a quiet day at home, watching football, whatever you do, enjoy the day. I know my family's getting together, my extended family for the first time in 3 years. We're hosting it at our house in Dorchester. I do all the cooking, so I'm going to be pretty busy, but it's going to be wonderful again to get together with my parents and my kids and my brother and his family, and we're all going to be very grateful and very thankful for that opportunity. So thank you so much for your support and your membership in Mass Retirees. If you are in the Westport area today, come on down and say hello at White's. Otherwise, we'll be talking to you again real soon. Take care, everybody.